Hello and welcome. My name is Shelby Christian, and I'm with Community Health Works. We're a nonprofit organization working to make Georgia communities healthier. Today, the focus of this presentation is going to be lung cancer awareness. We're going to be going over some statistics surrounding lung cancer, some signs and symptoms, what the cause is, or well, the primary cause, as well as what's the screening method for it. And so without further ado, let's jump right in. So the first statistic that I have for you today is that lung cancer is actually the third most common cancer type in this country. And the second that I have for you is actually that lung cancer is the #1 cause of cancer deaths in this country. So while it's the third most common, it is the most likely to die from. And our lungs, of course, they're located in our chest. They're responsible for making us breathe, right? And so lung cancer, simply put, is just cancer that has developed in those lungs. So what that means is that you've had a cell in your lungs start developing abnormally, and then it leads to uncontrolled growth, leading to a tumor and cancer ultimately. And so, like any other cancer, there's stages to lung cancer. You'll see on the screen that I've put 4 different types here to kind of give you an idea of the size compared to each of the types. So the first stage is, of course, stage 1. It means that the tumor is less than 3 centimeters, so it's still pretty small, and it's if you catch it early, it's not going to be too much of a problem, and they'll be able to take care of it. Stage number 2, it means that it's about 3 to 6 centimeters big, which that might not seem very large, but when we put that into our lungs, the organs that are responsible for breathing, that really does start to become a problem. And if you haven't gotten it checked and it keeps on going, you'll reach stage 3. And stage 3 means that it's more than 6 centimeters and that it's spread to local lymph nodes. We have lymph nodes all in our neck, through our armpits, all throughout our body. We have these lymph nodes, which are responsible for helping clear out sickness and have to do with the drainage of liquids through our bodies. But when you have lung cancer, there's a chance that it can spread, right? And in stage 3, that means it has spread to the lymph nodes. And then, of course, stage 4, that's a really unfortunate stage to talk about. That means that the lung cancer has traveled beyond the lungs and beyond those lymph nodes locally, and it has detached from the original cancer and traveled elsewhere within the body. So you'll see I have the little piece after the words to indicate that it's not there anymore. It has traveled as well. So it's both there and it's elsewhere. So what are the signs and symptoms of lung cancer? I want you to remember that everybody is different and everyone might react differently to having lung cancer, but the most common symptoms are first and foremost chest pain. You might be having some pain in your chest and localized spot. You're noticing it in the same spot just about every time, and it's hurting. It might be a dull ache. It might hurt really badly. Everybody's different. You might also experience shortness of breath, meaning you're having trouble breathing. Talking like this, you might need to stop and breathe for a second, or you might be wheezing, right? You're just having trouble breathing. The next one is that you might be coughing up blood, right? Like if the cancer has gotten to a point that it's affecting the function of the lungs, deteriorating part of the lungs, you might be coughing up some blood. The next thing is like a persistent cough or hoarseness, meaning you're not talking as well, you're struggling to talk, and you're coughing a lot. And then you might also experience bouts of bronchitis or pneumonia, right? It's a lot easier for sicknesses to jump onto us if our body's already trying to fight off cancer. And bronchitis and pneumonia both affect the lungs, and so that's why that happens, because your lungs are not as strong, your immune system's already busy trying to fight off the cancer, which is not an easy thing for the body to do, obviously. So bronchitis and pneumonia are easier to get onto you. You might be having unexplained tiredness. You might just be feeling very lethargic, and that's because your body is using a lot of its resources trying to get rid of this. And then the last one might be unexplained weight loss or loss of appetite, and that comes with just any cancer in general. Cancer does often lead to weight loss. It doesn't always, but it can, and especially as it reaches later stages, you would see this. Now, it is no surprise that smoking is the #1 cause of lung cancer. Smoking increases your risk of cancer in general. Any cancer type, your risk is being increased if you smoke, whether that's smoking cigarettes, that's vaping, anything of that nature. But when we talk about the lungs, when you're smoking, breathing in like ash or whether it be chemicals with a vape, whatever it is, if you're breathing that in, you're breathing in foreign substance that your lungs are not supposed to have, right? The job of our lungs is to breathe in oxygen and to give our body the oxygen that it needs. And so if you're smoking, you're introducing things that are not so good for our body into our lungs, aggravating the lungs and increasing your risk of cancer. And so that's why smoking is the #1 cause of lung cancer. It's more often than not that lung cancer patients are those that have a history of smoking. Now, this isn't to say that if you never smoke, you're in the clear. There are instances of folks who never smoke and do get lung cancer, and that's because cancer can form anywhere in the body. However, smoking exasperates that a lot. It increases your risk more than anything else will for lung cancer. So it's very important that if you're somebody that smokes, really consider quitting. I know that can be hard, but it's really good for you in the long run and for your lungs and your body. And if you are somebody that smokes, you can kind of calculate your odds just a little bit with what's called your pack years. So what you do is you calculate your number of packs a day that you smoke times the number of years that you smoked them. So let's take, for example, if you smoke 1 pack of cigarettes every day for 20 years. 1 times 20 is 20. If you smoke half a pack of cigarettes a day for 40 years, that is also 20 because 1/2 times 40 or 40 divided by 2 is 20. So if you have a pack year history that equals 20 or higher, that means that you should be getting lung cancer screening. Your risk of lung cancer is high if you have a 20-pack year smoking history, and this is most often found in folks who are about 50 to 80 years old, somewhere in that age range, just because it generally takes that long in life to reach that pack year history. However, you calculate your own personal pack year history to determine if you should be getting a lung cancer screening. It doesn't necessarily matter your age. If you have that 20-pack year history, you need to talk to your doctor about this. So we already addressed that smoking is the #1 cause of lung cancer, and it roughly increases your risk of lung cancer by about 20%. But that's not the only thing that can cause lung cancer. You heard me say you'll hear that people who never smoked can get lung cancer. And that's because there's a variety of things that go into this. The other thing that I really want to stress is family history. If you have someone in your family, specifically someone that is a first-degree relative, so like your mother, your sibling, anyone close to you or immediate family, then you need to talk to your doctor because you're at increased risk for lung cancer. Generally, we don't see lung cancer until the age of about 50 to 70 years old. So if you're in that age range and these things somewhat apply to you, talk to your doctor. Asbestos exposure is another risk factor for lung cancer. Asbestos is a rocky mineral that was used a lot in the industry years ago. And so it's not still used, but you would know if you're someone that this applies to. It was used a lot as an insulation material and in other things. So if you've had asbestos exposure, maybe you've renovated a house that had it, you would know. Another thing is pollution, right? So if you live in a larger city or somewhere with high industry, factories and whatnot, you'll be exposed to environmental carcinogens through the pollution. And so when you're breathing that in, that's also over time going to increase your lung cancer risk. Another thing is if you've had prior radiation treatment. So like ladies or men, if you've had breast cancer treatment that involved radiation, then your risk of lung cancer is higher because your chest area has been exposed to radiation previously. Another thing is about radon gas exposure. Radon doesn't smell like anything. You might hear of folks having radon detectors in their homes. It's very common if you have a basement. that you want to have a radon detector there. That way you can see and figure out if there's any of this gas coming up from the ground, because it's found in the ground, it's found in the soil, and it can come up into homes from there, especially with basements. The other thing is, like, depending on your work. If you work in construction, if you work in manufacturing or a mining industry, a factory, whatever it may be, if you're in one of those types of occupations that you have dust in the air a lot, or even like think landscaping, right? Anything that's getting dust material into the air that you're breathing in a lot, you're aggravating your airway a lot. And so that's going to increase your risk as well. And then also illness, right? So if you're somebody that already has been diagnosed with something like COPD, if you have tuberculosis, if you have bronchiectasis, anything of those natures, you're at increased risk of lung cancer because your lungs are already tired. So we talked a little bit about how if you have a 20-pack year history, you need to talk to your doctor about screening. This is what the screening is. It's very simple. It's just a CT scan, and it's a low-dose CT scan. It's where you'll lay in the machine, you'll sit there for a minute while the machine spins to take images of inside of your body. And this is really encouraged for people who smoke. You've smoked within the last 15 years, and you have a 20-pack year smoking history. And you're the age 50 to 80 years old, of course. The other thing I want to mention is that if you're somebody that the previous slides materials applied to, that information applied to, then talk to your doctor about the possibility of screening for yourself as well. And as always, I always like to leave you guys with a little bit of information to be able to get in touch with us if you'd like to do so. You can see that our website is there, chwg.org. We have this information and more on our website, so please feel free to go check it out. You can scan that QR code to get to our social medias to keep up with us as to what we're doing, what kind of information are we promoting, what fun things are we sharing. And if you ever want to chat with us, we can have a talk. You can give us a phone call at the number listed, or feel free to shoot us an email. But I hope that this was informative to you, and have a great day.